Committee Reports Take Note Debates. Number 1, Report of the Select Committee on Remote, Rural and Regional Health, entitled The Implementation of Portfolio Committee Number 2 Recommendations Relating to Cross-Jurisdictional Health Reform and Government Consultation with Remote, Rural and Regional Communities, Report 358.
The question is that the House take note of the report. I call the member for Wagga Wagga.
Mr Speaker, I rise today as Chair of the former Legislative Assembly Select Committee on Remote, Rural and Regional Health, which tabled its third and final report on the 22nd of May 2025. The committee was established to examine and report on the implementation of recommendations made by the Legislative Council's Portfolio Committee Number 2, also known as PC2, in its 2022 report. The PC2 report made 44 critical recommendations for regional health reform, and over the past 2 years, this committee has been monitoring progress against these recommendations over the course of 3 inquiries. Our first report examined workforce issues, including workplace culture and funding, while our second report looked at the delivery of specific health services and specialist care. And I do want to thank the Minister for establishing the committee and allowing me the role to chair the committee. It's one of the very first actions taken by the government in this parliament, and it has been a very fruitful 2 years. This final report of the committee focused on cross-jurisdictional health reform, collaboration and government consultation with remote, rural and regional communities. Importantly, this report also sets out a recommended pathway forward, including key priorities, new accountability measures and next steps to ensure that the health needs of these communities remain a priority into the future. The report begins by examining cross-jurisdictional health issues with a focus on rural and remote primary care and collaboration between local health districts and primary health networks. During the inquiry, we heard that rural and remote primary care is in crisis, with general practitioner staffing shortages predicted to worsen by the end of the decade. Despite this, government responsibilities to address GP shortages remain unclear, and this critical work is falling between gaps in governance. We recommend measures to improve shared governance arrangements and the development of a new long-term funding model for rural and remote primary care. This funding model should consider how funding can be pooled to overcome service fragmentation. We also recommend funding to expedite the use of innovative, multidisciplinary models of health service delivery that are responsive to the needs of remote, rural and regional communities, and this includes the health precinct model, which aims to facilitate partnerships across the public and private sector and bring together hospital-based care, primary care, education, industry, local government and non-government organisations. During this inquiry, we also heard that consultation between local health districts and communities remains limited, and the Local Health Advisory Committee model is not providing a consistent forum for genuine community consultation and input into local health services across remote, rural and regional New South Wales. We recommend that New South Wales Health work with LHDs to formalise the requirement for genuine consultation as part of their health service planning process, and to ensure that all communities have access to a forum that enables frank and meaningful feedback. Finally, the report looks back at some of the persistent, unresolved issues that this committee has observed over the course of its 3 inquiries. These include critical staffing shortages within rural and regional health system, a poor workplace culture and working conditions, and an over-reliance on locum doctors. We conclude the report with our assessment of progress against the 25 PC2 recommendations that New South Wales Health has reported as complete. The committee notes that the progress reported by New South Wales Health continues to be at odds with what communities and stakeholders are experiencing on the ground. We are concerned about the extent of progress reported and believe that the intent of many recommendations remains unfulfilled. There is a clear need for ongoing accountability measures to ensure that reforms are implemented and the health needs of remote, rural and regional communities are appropriately addressed. To do this, we recommend the establishment of an independent New South Wales Remote, Rural and Regional Health Commissioner that is empowered to hold New South Wales Health accountable in implementing reforms to improve the regional health system. We also call for a number of other monitoring and accountability mechanisms, including regular reporting to Parliament, additional funding for the Audit Office to undertake performance audits into key priority areas. The committee commends the New South Wales Government's stated commitment to implement all of the 44 recommendations and for its support of the committee's work. We also acknowledge the positive steps that have been taken since the report was made. These include the implementation of the Rural Health Workforce Incentive Scheme and improvements to the Isolated Patients Travel and Accommodation Assistance Scheme, as well as expansion of the Rural Generalist Single Employer Pathway. However, the rate of progress has been too slow and significant reform of the remote, rural and regional health system is needed. We believe that the implementation of recommendations in this report, including mechanisms for ongoing oversight, will help to ensure that remote, rural and regional health remains at the forefront of the New South Wales Government policy in the years to come. On behalf of the committee, I'd like to extend my gratitude to every organisation, healthcare worker and individual who contributed to this important inquiry and acknowledge those who made regular contributions across the committee's 3 inquiries. I would also like to thank New South Wales Health for their assistance and all of the health service executives who helped us. And finally, I would like to thank particularly my fellow committee members for their sincere and ongoing engagement and hard work in the last 2 years. It's been a joy to work with the committee members. Our Deputy Chair, Janelle Saffin, and in the House here we've got the member for Cessnock and the member for Blue Mountains. Thank you for your contribution. The member for Albury recently joined the committee as well. And the other members who were on the committee, the former member for Port Macquarie was a key member, the member for Myall Lakes has also made a major contribution, the member for South Coast. And I also would like to thank the committee secretariat, including Matt Johnson and Carly McKenna, who've supported our work, as well as all of the other committee members. Mr Speaker, this is a turning point now. It's clear that much more needs to be done in rural and regional health. We've mapped a pathway forward, and I believe that that pathway will make a big difference to our communities, and I encourage the government to respond to our report in a positive way. Thank you.
Thank the member for Wagga Wagga. I call the member for Blue Mountains.
Thank you, Mr Speaker. I rise also to acknowledge the work of this excellent committee, the Select Committee on Regional, Rural and Remote Health, and access that those communities have to healthcare, and particularly the recommendations relating to cross-jurisdictional health reform and government consultation with those communities. The member for Wagga Wagga and the chair of this good committee has just provided a very comprehensive account to the huge amount of work that was undertaken. And I just want to focus on a couple of the points just to reiterate the significance of the work around the recommendations. There has been a focus on rural and remote primary care and collaboration between local health districts and primary health networks, and as the good member pointed out, we do recommend measures to improve shared governance arrangements and the development of a new long-term funding model for rural and remote primary care, and how we can deal with that service fragmentation, which we came across time and time again. I really wanted to also, as a member of this committee, as a member of an area that considers itself regional but is actually part of the Greater Sydney network, talk about the persistent and unresolved issues that this committee has observed over a period of time, and particularly note that critical staffing shortages within the rural and regional health system, poor workplace culture and working conditions and an over-reliance on locum doctors came through as issues which demand a response from government. So, Mr Speaker, you know, as the member for Wagga Wagga pointed out, and I'm sure every member of our committee, we thank every organisation, every healthcare worker, every individual who took the time to write to us as they're dealing with this crisis, and to clearly articulate what they're going through and what they need. And the work of New South Wales Health should be also acknowledged, and our excellent and hard-working committee staff, without whom we could not have undertaken this work. I also note our other committee members, and particularly the member for Myall Lakes, who isn't able to be with us this week in the Parliament because she's dealing with the impact of the flooding in her community. Many of us come into this work, and it is often unreported, actually, in the way in which politics might be accounted for through media stories. This good work that people across the political spectrum, across parties, do on behalf of our communities, and pointing out, based on the voices and the stories we heard, 44 recommendations that we do trust the government will take seriously. And one final point, I'd like to thank the Minister for Health. The seriousness of the issues that we have been dealing with and hearing from people about is demonstrated by his establishing this committee, and I commend the report to the House.
Thank the member for Blue Mountains. I call the member for Albury.
Thank you, Speaker. I welcome to take the opportunity to speak on the third and final report of the Select Committee on Remote, Rural and Regional Health. And I was just drawn to the, in terms of the member for Blue Mountains' contribution, and just couldn't help but think that the member for Blue Mountains spoke of being in that interface between regional and metropolitan. So wherever we are in the health system, we come up against these interfaces, and it leads to, as the Chair so well put it, gaps in governance and some of the challenges we face in that regard. And I use that as a preface to, like the member for Blue Mountain, acknowledge and thank all those that have been involved in this, to the Chair, to fellow committee members, committee staff, but importantly to those right across our community, our healthcare workers, and importantly those with lived experience in the community. Thank you for your contributions to these reports. It's a fairly stark start to the report with what the Chair outlines in his foreword, where he says that 3 years on from the Portfolio Committee's number 2's report, communities in remote, rural and regional New South Wales continue to face significant challenges in accessing health services, especially rural primary care and maternity services. And he goes on to speak of the concern the committee has around the extent of progress reported against the recommendations. Having said that, there are some really constructive elements that come through in that regard, and like the Chair, I want to, for me, the notion around the precinct model is really important. At the moment, currently, our community in Corowa, looking at the services plan for the Corowa Hospital, part of that conversation that we're looking to drive forward is perhaps being able to be considered as part of a PRIMS model, which the Chair touched on, or even the community care model, which is the current model in New South Wales. To that point, it is how do we engage or have our community engaged? What's the shared definition around it as well, between local health districts, New South Wales Health, and also in terms of our community in that regard. I think that's something that we really need to drive forward on in terms of those innovative multidisciplinary models that we need to be looking at. It would be, for me, obviously, it's important to acknowledge and note the part of the report that touches on Albury-Wodonga Health and 2.26, where local government New South Wales cited challenges for Albury-Wodonga Health being a cross-border health service, as well as Cootamundra-Gundagai. That is our lived experience, and for me, a big part of that has been looking at the end of the day, the frameworks that we set up, the foundational documents. How do we, again, meet those gaps in governance? And for Albury-Wodonga Health, right back to its original intergovernmental agreement that was established in 2009, it set up an interdepartmental committee that was to meet twice yearly, but only during the transition period, which was marked from 2009 to 2012. So the foundational framework did not put in place the engagement that was required, the interface that was required between New South Wales and Victoria. And that was something that confronted me when I first came into Parliament in 2019, and the fact that IGA remained unsigned and renewed, and something that I pushed for and was pleasing to see that in the latest iteration that was signed in 2022, that there is a strategic planning committee with working together in good faith, as the document says, to agree to matters that are set out. Really important to make sure that we get that interface right, and a big part of that, in our experience with Albury-Wodonga Health, has been the framework, the foundational documents. Much more that we need to work on, but I commend this report. Thank you.
Thank the member for Albury. I call the member for Cessnock.
Thank you very much, Speaker, and I too rise to make a contribution to the Select Committee on Regional, Rural and Remote Health third and final report. I think I do it as much as anything else as a little bit of personal therapy. The journey, the 2 years has been stimulating and frustrating, exciting, revealing, and also, I guess, concerning. We're incredibly lucky to have the member for Wagga Wagga, who himself, of course, we all know in this house as a doctor, and came into this place having at the time been working in the public health system primarily, and he spoke the language. And you know, we'd be in meetings and there'd be a whole bunch of lingo going backwards and forwards, and on most occasions I'm sure the member for Wagga was the only person who really understood some of the stuff that was being said, but he was kind enough to explain it to us in simple terms afterwards. So that's the first thing. The second thing is that I actually really value and appreciate the nature of the words in this particular report, because if people read it carefully, and even if you read the chair's forward, I think there's a sense of we're at the end of this 2-year journey, but it's still a little bit frustrating. Like, it's still hard to see, you know, where this massive beast known as New South Wales Health has changed shape and size and scope, and what it's doing differently. And you know, I think about it like in terms of a cruise liner sort of trying to turn around. It changes in minute little ways for a long time before you can actually start to see a bit of an arc. And I think that's the journey for New South Wales Health at the moment. I share the Chair's concerns about some of the, I guess, reports into or reflections on where the 44 recommendations are at the moment. I endorse the Chair's words that on the one hand, New South Wales Health were presenting to us a report that said they'd made progress or achieved or, you know, finalised and finished a number of those recommendations. But in reality, the people that we were meeting on the ground, the hospitals we were visiting, the communities we were talking to, and indeed some of the personal patients and or employees were telling us something significantly different. And if I can just give one really simple small example, and it's about local health advisory committees. 3 years on from the tabling of that upper house report, which recommended, you know, the re-establishment and increased engagement with local health committees, we still haven't achieved that. Now, this isn't setting up something new. This is simply building on something that should have already existed, and in some areas it might have waned during COVID, etc., etc. But we still don't have local health committees set up and running. Like, to me, of all the recommendations, that seemed like the simplest, and we haven't got there yet. So there's still a lot of work to do. I know that the new government and the new minister, and I know the previous government committed to, you know, the recommendations. 43 out of 44 from the previous government and 44 out of 44 from this government. But there's still a heck of a lot of work to do. And as we now expire our 2-year term as this select committee, I guess I warn and plead that someone keeps paying attention, and in that regard I absolutely support the idea that we would actually have a commissioner. I want to finally thank the doctor, of course, all my colleagues. I want to thank the Secretariat, Matt, Carly, Sukraj, Joan, Jan and Nicole. We've got volumes of paper that I can now shred. Thank you.
Thank the